Yes, now we are going to discuss about the test for renal tubular function. Okay, before going to this tubular function, you should know about the three normal values, because you are going to analyze these three values only. If it is increase means what, if it is decrease means what, like that. Normal plasma osmolality is 285 to 300 milliosmoles per day per kilogram. Normal urinary osmolality is 60 to 1200 milliosmoles per kilogram. The variation is very gross. Starts from 60 and ends in 1200 milliosmoles per kilogram. Specific gravity, all of you know about that, 1.005 to 1.025. This is the basic parameters for your tubular function. Assess the kidney tubules. We have one triad of renal function test. The first one is first one is this, second one is this. Here, urine acidification test. Urine acidification test. That means we are giving some acidic compound and measure the osmolality, volume, specific gravity, like that. This is the diagnostic test for renal tubular acidosis. Very, very important MCQ. That is, urinary acidification test is the tool for renal tubular acidosis. So, where the defect is in tubules to handle the hydrogen ions and bicarbonate ions. That is, metabolic acidosis also we are going to monitor or assess. Ammonium chloride gelatins, they will be giving to the patient to produce metabolic acidosis. After that, it causes acidification of urine. Okay, this is the procedure. After that, the interpretation is like this. The patient's pH is less than 5.5 means the patient kidney is in normal. Tubular function is normal. Because urinary pH is 5.5 to 7.5. Okay, this is normal. Whereas the pH is 5.5 to 7.5 after giving the ammonium chloride gelatin means, that is, patient is going for metabolic acidosis also. Patient is having acidic urine. Patient is having disturbance of the that is hydrogen and bicarbonate ions. In spite of these, the patient's pH is between 5.5 to 7.5 means the patient is in abnormal condition, usually renal tubular acidosis. Right? This is called urine acidification test. Right? Here the normal urine pH is 5.5 to 7.5. Blood pH, 7.35 to 7.45. Next one is, this is actually second. Third, urine concentration test. We ask the patient to go for the deprivation. Don't take for the 15 hours, 10 to 15 hours, no water. Deprivation, water deprivation test. 15 hours, no water for the patient. Then the next day morning, first urine sample, it should be discarded. Second specimen will be collected, and you have to go for the analysis of specific gravity and osmolality. Actually, you have urine osmolality and plasma osmolality. We have the ratio for the urine osmolality and plasma osmolality, but we are measuring only urine specific gravity and urine osmolality. So, the normal level is 1.025, osmolality is 850 milliosmoles per kilogram. If the urine concentration test or the kidney is not able to concentrate the urine means renal concentration ability is impaired, means due to the tubular defect. What are all the diseases? Decreased secretion of ADH, that is diabetes insipidus, or the renal tubular defect. These are all the two conditions for the urine concentration test, that is fluid deprivation test. And the last one is urine dilution test. Here what you are going to do, from the midnight to morning, no water. After that, you are going to give some 1500 ml of water within 30 minutes. You ask them to drink water. Then you go for the within 30 minutes, they have to take the 1200 ml of water. Then you have to measure the volume, specific gravity, osmolality like that. Okay. So next 4 hours, that is every hour for next 4 hours, you have to take the measurement. Usually, normal specific gravity and osmolality will be decreased in this normal patients. Usually decreased. If the osmolality is normal, specific gravity is also normal, means the patient is having some problem. Okay. So next 4 hours decreased. That's all about urine dilution test. So you have to divide your renal function test into 3 classification. One is renal functions, classification of renal test, clearance. What do you mean by clearance? In that clearance, you are having urea clearance, inulin clearance, creatinine clearance, but we are routinely doing creatinine clearance because it is the one of the important compound in our body, which is non-enzymatic conversion of creatine phosphate to phosphate, which is continuously produced, which is not affected by diet or any exercise. Like that, the positive conditions are favorable for the creatine. That is why we are following creatine clearance test. Second one is glomerular permeability markers. Coming under this title, we are having 3 types of proteinuria: glomerular proteinuria, tubular proteinuria, overflow proteinuria. You have to mention 1 or 2 lines about all the 3 types of proteinurias and give 1 to 2 examples for each conditions. Coming to the tubular function test, again we have triad, that is 3 tests. One is urinary acidification test, another one is urinary concentration test, third one is urinary dilution test. In the acidification test, we are giving some ammonium chloride to make the patient's electrolyte disturbed. Then we have to measure the pH. First one is measure the pH only. Next and second and third is dilution and concentration test. Here we ask the patient to go for deprivation and measure the urinary specific gravity and urine osmolality. Whereas in urine dilution test, we are asking the patient from midnight to morning 7 a.m. don't take water. After 7 a.m. we are giving 1.5 liters water and ask them to take within 30 minutes. Then every 1 hour, that is for 4 hours, we are measuring the urinary volume, specific gravity and osmolality, and we are going to interpret the changes. If the level is normal, means they have some problem. If the level is decreased, means patient is in normal kidney tubular function. Like that, you have to divide it into 3 portions of renal function test. Okay.